Hi, I'm Esther Echegene, the lead podiatrist at Excellent Care First. Excellent Care First is a private health care provider focusing around foot health, a medical profession known as podiatry. In Excellent Care First, we take care of our patients in clinic and in their homes, also in care homes. Today, we will be talking on common foot health issues among the elderly.
Good day, my name is Natalie Feely and I'm part of the Excellent Care First podiatry team. So I'll just tell you a little bit about the service that we provide. So we do annual diabetic foot checks. We serve as an extra pair of eyes and ears to the care staff when it comes to monitoring and checking the feet as well of the residents in your care home.
Podiatrists treat and manage injuries and conditions as well as foot complications resulting from ongoing health issues such as diabetes. You might hear a podiatrist being referred to as chiropodist, podiatric physician, doctor of pediatric medicine. All podiatrists treat, diagnose, and prevent the conditions of the lower limb, such as foot, ankle, and lower leg, including lower limb surgery, biomechanical assessment and treatment. Specialist areas that podiatrists also treat and manage include the following: vascular, acute diabetic support, pediatrics, and they are able to prescribe medication. Common foot problems in the elderly include the following: bunion, hamartosis, nail disorders. In the elderly, you might see thickened toenail, fungal nail infection, and all these are very difficult to manage. So you need the podiatrist to manage such conditions. Foot pain is very common in the elderly. This could be at the forefoot, it could be at the arch of the foot, it could be at the heel. These are also common in elderly. Fractures, sprain, muscular issues. These are very common in elderly people. Diabetes and peripheral diseases, dry skin, corn, and calluses. Diabetes foot complications. Diabetes is a condition that occurs when there is high level of sugar in the blood or uncontrolled sugar level in the blood. There are two main types of diabetes: type 1 diabetes and type 2 diabetes. And there is another type of diabetes called gestational diabetes. This diabetes occurs during pregnancy and goes away after birth. And this puts the women at risk of developing type 2 diabetes later in life. The aging population are at risk of developing type 2 diabetes. Diabetic foot is mainly caused by uncontrolled diabetes, leading to the development of the following: peripheral neuropathy and peripheral arterial disease. Peripheral neuropathy is when someone has lost protective sensation. And arterial disease is reduced blood flow, which occurs on the feet. Ischemia can occur as a result of arterial disease. Many people with peripheral arterial disease may not present with any symptoms, while others may have mild symptoms. Some of these symptoms noted during peripheral arterial disease include the following: claudication, which is pain on the calf or on the thigh during walking, and this stops people from walking, and after resting they are relieved. Also, leg pain while resting, call it rest pain. So this can wake people from sleep, and they have to hang their legs over the bed in order for the pain to be relieved. And this disappears after a while. Painful cramp in the hip, thigh, or calf muscle can also be one of the signs and symptoms of peripheral arterial disease. Weakness or numbness, tingling or feeling of pins and needles in the lower leg or feet is also sign of peripheral neuropathy. Cold leg or foot, sores on the legs or feet or toes that are not healing. These are also signs of peripheral arterial disease, because if there is insufficient blood flow to any part of the body, that part of the body will not be receiving enough nutrients. So healing will be delayed as a result of this. Change in color of the leg, change in temperature also could occur as a result of this, and this could be a sign of something serious going on. Loss of hair or slow growing hair on the leg or feet is also a sign, because that part of the body is not receiving enough nutrients, so things will be slow. Shiny skin also is a sign of peripheral arterial disease, because it might look pale and shiny as a result of insufficient nutrient to that part of the body. Weak pulse or pulselessness on the feet or leg is also as a result of peripheral arterial disease, because the part of the body is not receiving enough blood flow. Also, peripheral neuropathy signs and symptoms include the following: due to the damage of the peripheral nerves, someone could often have weakness or numbness, pain, usually in the hands or feet. It can also affect other areas and the body functions, including digestion, urination, and circulation. Other symptoms of peripheral neuropathy include the following: shooting, burning, stabbing pain, as I said before, tingling, electric shock-like pain, electric shock-like pain, or pins and needles feelings. Basic management to prevent diabetes foot complication includes the following: managing the symptoms and preventing progress of these conditions, and lifestyle changes are the primary treatment options. Medication to control blood pressure, control cholesterol level, also to control blood sugar level is very important. Others might need other medication to prevent blood clots. Self-care management is very important. Quit smoking, exercise regularly, keep check on sugar levels and blood pressure. Medical procedures might be needed in some cases, such as angioplasty and bypass surgery. Nurses and other caregivers play a significant role in identifying foot health problems that may need further assessment and treatment by a podiatrist. Good communication and liaison between primary care nurses and podiatrists are important to maintain high standard of care. Understanding a patient's problems, keeping up-to-date records of patients are important, including sharing up-to-date records with other healthcare professionals, including the podiatrist. Tips on foot care for people with diabetes include the following. As caregivers, we need to help inspect both feet of the residents or the elderly, including the areas in between the toes. Ensure feet are washed daily with water at room temperature, with careful drying, especially between the toes. Keep skin moisturized, but not between the toes. Podiatrists can recommend some cream to help with dry skin. Arranging a podiatry routine foot care is very important. Corns and calluses should be treated by the podiatrist. Always encourage residents or the elderly to wear stockings with shoes and check inside shoes for foreign objects before wearing them. Avoid walking barefoot at all times. Corn and calluses are hard or thick areas of the skin that can be painful and can be detrimental to patients with diabetes or neuropathy. Podiatrists reduce calluses and remove corns painlessly. Sometimes may apply padding or insole to relieve pressure or for corrective purposes or for a long-term relief. We sometimes apply simple dressings after removing callus or corns. The following are some of the simple dressings podiatrists use. Meloline. Meloline is a low adhesive absorbent and it can be used for varieties of light to moderate exuding wounds. Maple dressing also is used. It is a self-adherent dressing that absorbs blood or exudate. We also use Tubifol. We use table foam is to relieve pressure. Table foam is a foam material in a tube shape, which can be used after removing comb or ingrowing toenail. Also, we have tubinet, which is also used to hold dressing in place. Orthotics. Why we use orthotics include the following: to provide cushion and comfort to the foot, to support the abnormal movement of the foot. Orthotics are also used for offloading in the case of wound and healing. And we have different materials that can be used, and these are very good. This is poron, and there are different types of poron, and this can be used as a lining to the top of insoles. So the rules in using insoles include the following. It is very important that when you are using insole, whether prefabricated insole, which is already made insole, such as these ones, there are different types of them, and this type of fabricated insoles can be cut to suit your shoe size, and it can be modified to what we want to use it for, or the problem we want to address. And we have custom-made orthotics. Custom-made orthotics is orthotics mainly made for your foot, to suit your foot shape, foot problem. The footwear should have the following features: deep, wide, and supportive. It must have a removable insole. Slight heel. It must not be high heel or flat heel. Lace up. Supportive buckler or Velcro strap support to hold your feet in place while walking. The orthotics should be fit into trainers, casual shoes, and the work or school shoes. Footwear is very important. So in every footwear, whether using insole or non-insole, occlusive or narrowed or tight footwear should be avoided because it could cause sweating and can also predispose to fungal infection. Ideally, footwear for the elderly and those with diabetes should have a wide toe post, soft cushion soles, extra depth to secure the feet, accommodate foot deformity. Orthotics is required, and the laces or Velcro for fitting and adjustments of any conditions of the foot. A new pair of shoes or orthotics can be worn for a short while daily until comfortable, as said before. When to see your podiatrist or your GP. If the resident or the elderly experience the following symptoms, don't wait for the next appointment time. It is important to see your doctor or podiatrist regularly. So if there is any concern, just contact your GP, and if it has to do with your foot, contact your podiatrist immediately. If the resident or the elderly is feeling pain in their legs or cramps on the buttocks, thighs, or calf during work or during rest, the healthcare professional, GP or podiatrist, need to be contacted. Tingling, burning, and pain in the feet, loss of sensation, ability to feel heat or cold, a change in shape of the foot over time, because that could be charcoal foot and it needs to be handled immediately. Loss of hair on your toes, feet, or lower legs, dryness of the skin, scratched skin or blisters, a change in the color or temperature of the foot, thickened or yellow toenails, because it could be a problem. Most times, yellow toenail might be as a result of fungal infection and could be as a sign of systemic disease. So you need to see your podiatrist or your GP immediately. A blister or sore, ulcer, infection, or infected corn or ingrowing toenail need to be reported to the GP or the podiatrist straight away.